Our lungs are incredible organs. Every single day they work tirelessly, pulling in the air we need to live and pushing out the waste our bodies don't need. Think of them as two large spongy balloons inside your chest, expanding and contracting with every breath. This constant exchange with the outside world is essential for life, but it also means our lungs are exposed to tiny invisible invaders like germs. These germs, which include bacteria, viruses, and fungi, can sometimes get past our body's defenses and cause an infection. When this happens in the lungs, it can become a serious health problem that requires medical attention. A lung infection is when one of these harmful germs starts to grow and multiply inside the lung tissue. This causes the small air sacs in our lungs, called alveoli, to fill up with fluid or pus. This inflammation makes it much harder for oxygen to pass from the lungs into the bloodstream, which is why people with lung infections often feel short of breath. It's kind of like trying to breathe through a wet sponge. Understanding these infections is the first step toward protecting our respiratory health and knowing when to seek help from a doctor. The most common and well-known lung infection is called pneumonia. However, the term pneumonia is actually a broad label for many different types of lung infections. It's not just one single disease. Doctors categorize pneumonia in several ways to understand it better. Media group, healthcare professional categorizing x-rays, doctor pointing to chest x-ray and explaining findings, table showing pneumonia types in medical office at stock and at distribute _equally, where a person got the infection, what type of germ caused it, and how it looks on a medical scan like an x-ray. This careful classification is not just for medical records. It is crucial for choosing the most effective treatment to help the patient recover as quickly and safely as possible. In this discussion, we will explore the world of lung infections. We will break down the different types of pneumonia so you can understand what they are and what causes them. We will also look at other common infections that can affect the lungs, such as bronchitis and tuberculosis. By the end, you will have a clearer picture of these conditions. This knowledge can empower you to ask the right questions and work with your healthcare team for the best possible outcome if you or a loved one ever faces a respiratory illness. It's all about being informed. One of the most practical ways doctors classify pneumonia is by looking at where the person was when they became infected. This often provides important clues about the type of germ responsible and how to treat it. The most common type is community-acquired pneumonia, or CAP. This means you caught the infection in your everyday life, at school, work, or the grocery store. The germs that cause CAP are usually less aggressive than those found in medical facilities. A common example is getting sick after a classmate or coworker with a bad cough spreads germs through the air.